Hi everyone, welcome to our YouTube channel 3 Minutes of Interventional Radiology. Today we are going to see one more interesting topic about the thyroid nodules. Thyroid is an endocrine gland which is present in front of our neck right here. So it is not usually visible outside, but in some conditions, especially in females, that too in young females in the adolescent period or in the peripartum, that is in and around the pregnancy duration, the thyroid becomes swollen in size. That is due to the increased requirement of the thyroid hormones for the mother, or increased requirement of the thyroid hormones for the young females and the mothers during this period. This creates an visually a bad impact on the female, but remember, this is not cancer and this is not lethal for life. Very rarely it causes mass effects like difficulty in eating or change in voice or difficulty in taking breath. But the treatment usually followed for this is surgical excision. That is, there is large scar on the neck and you need to remove this thyroid gland. With the help of interventional radiology, we can do this without the presence of any large scar or without the requirement for any anesthesia. Under ultrasound guidance, we pass a very thin needle into your thyroid nodule. With the help of this needle, we connect it to an RF generator or a radio frequency generator. In simple terms, it's an electric generator. And with the help of electric waves, we burn this entire thyroid nodule without affecting the rest of the thyroid gland. The major difference with this when compared to surgery, you'll find a very big scar, which is cosmetically sometimes not acceptable, especially in the young females. Here, you do not have any scar at all. Surgery requires complete general anesthesia. Here you do not require any anesthesia to do this procedure. Surgery requires hospital stay. For this RF ablation, you do not require any hospital stay. You can go back home as soon as the procedure is finished. Surgery is a longer procedure. RF ablation is very short. It takes hardly 25 to 30 minutes to complete the entire procedure. And 30 minutes after completing the procedure, you can go back home. After surgery, the patient needs to use thyroid hormone throughout their life. In radiofrequency ablation, as the normal thyroid gland is not being affected, there is no need to use any hormonal replacement throughout the entire life. And this procedure is almost the same cost as that of any surgery. And a few more facts about thyroid nodule disease. Thyroid nodule disease, or large thyroids which we see in young females, are mostly not cancer conditions. These are benign nodules, so they are not going to spread elsewhere. By doing a small FNAC, that is a small needle test under ultrasound guidance, we can prove that this is not cancer and this is a simple thyroid nodule. After confirming that this is not cancer, then we go ahead for this RF ablation. Usually within a period of 3 to 6 months after performing the RF ablation, a nodule which is as big as 10 centimeter comes to as less than 0.5 centimeters in size. Means you have around a 90 to 95% reduction in size within a duration of 3 to 6 months after your RF ablation therapy. So what's the need to go for a more invasive therapy when you have as simple as a technique as RF ablation? Kindly subscribe our channel, and for those who have already subscribed, a big thank you. Please do visit our website endovascularclinic.com for more updates and more information. Thank you.